Hi everyone, welcome you guys to our group presentation. Today we will talk about what is IBT and ABA. Our group has Sanya, Tashiany, Khuong, and Yi, and we'll help you to understand more ways to support children with ASD. So, let's jump right into it. Introduction: An understanding of IBT and ABA. Children with autism spectrum disorder can benefit from a treatment like intensive behavioral therapy and ABA, which tries to help children gain critical skills and also help children with ASD may have a variety of symptoms, such as repetitive behaviors, communication issues, and social interaction problems. In Canada, 1 out of 66 children have ASD. Though its exact causes are unknown, ASD is thought to be caused by a confluence of environmental and genetic variables. Developing relationships and interpreting social cues are common challenges for kids with ASD. They can have trouble controlling their emotions and feel more anxious. And because of that, IBT and ABA will be there to assist them. But what exactly is ABA? ABA is applied behavior analysis, called ABA therapy, developed for persons with autism and other development disorders. Impacts behavioral changes and disruptive behavior, which may be caused by the environment. Implemented to monitor behavior, establish behavioral strategies for autistic children. Improved environmental surroundings through modifications which may lead to improved learning abilities and the learning of new behavior. The foundation of ABA therapy, or applied behavioral analysis, was first developed in the 1960s by Ivor Lowas. ABA is based on the idea that behavior can be analyzed, learned, and changed through reinforcement. The therapist works with the individual to identify problem behaviors and develop goals. It's designed to help them understand why they exhibit certain behaviors and replace those behaviors with more positive responses. Now that we have understanding about ABA, so what about IBT? IBT is a short for intensive behavior therapy. It's designed to treat children with autism spectrum disorder. It uses the principles and procedures from applied behavioral analysis to teach children new learning skills. Is a branch of applied behavioral analysis which ensure that children with autism have early detection and are treated, proving to assist in decreasing severity in autism and improve communication with children of ASD. Applied behavior analysis focus is to assess the individual with autism to identify the area or areas of behavioral challenges. When these areas are identified, then the principles are being applied to enhance the behavioral patterns and development changes. According to the Ontario Association for Behavior Analysis, there are key components that are essential in guiding an ABA program. These are target, defining, and selecting. The goal is to change identified behaviors such as the significant behavioral socially change must be clearly defined and have an operational definition through observation and measurable ways. This may include skills such as reading, problem solving, and disruptive or challenges behaviors. Second is behavior assessment. Prior to the onset of any behavior change program, an assessment of the student's current level of performance and occurrences of disruptive or challenging behavior must occur. Behavior assessment can include skill-based checklists, observing whether the behavior's skills are present or not, and analyzing events surrounding the displays of target behavior. With arranging antecedents behavior, it can be a response to someone's physical and social environment, be an instruction learning materials or the presence of people and other physical items. The next one is prompting. Prompts are a specific antecedent tool used by teachers or therapists to cue a learner to connect with the curriculum materials and giving correct or desired responses. Prompting can take on the form of physical guides, gestures, visuals, and verbal instructions or models. The next one is behavior outcome relationship. Learning occurs when the child's response or behavior is met with either a reinforcing or a punitive consequence. Reinforcement contingencies increase or strengthen skills and behavior. The next one is positive reinforcement. Positive reinforcement is when the presentation of an item or an event follows the occurrence of a behavior, resulting in an increase in the behavior. Error prevention and correction. This process is most applicable in teaching. Errors in how a learner responds to instructions and situations can occur. The next one is data collection and analysis. Integral to any ABA intervention program is data collection and analysis. Measures of student responses are gathered before, during, and after a specific program or intervention is implemented to assess effectiveness. It will be analyzed to see if a skill is improving or problem behavior is decreasing. The last one is generalizing skills learned. After a student has acquired a skill in the classroom, it is important to generalize learning across a variety of settings, people, materials, and circumstances. There will be some common strategies in ABA therapy. According to REGIS, there are several ways to implement ABA therapy. However, there are a few frequently used ways. When a program for ABA is developed, it can be guided by some common strategies in ABA therapy. Some common strategies of ABA are discrete trial training, which involves teaching each step of a particular skill and providing positive reinforcement when a client performs the skill successfully. Early intensive behavioral intervention, which is a comprehensive type of therapy that typically focuses on young children and is highly individualized based on a child's unique needs. Last one is natural environment teaching, in which clients have the opportunity to practice skills in real-world settings. For example, when a child practices a skill at school. Approach of IBT. Intensive behavioral therapy is a therapeutic approach that relies on the principles, methods, and techniques of ABA to treat children with autism using a one-on-one approach and the structured intensive program to achieve behavioral improvement. Intensive behaviors therapy program is applied between 20 to 40 hours, standard weekly, and normally includes alternative with small group activities to assist with this therapy. Immersive approach increases the rate at which children with autism learn by focusing on teaching young children learning behaviors, such as imitation, cooperation, and attention, by breaking complex skills down into small, incremental steps. According to Turning Point Children's Therapy and Development Center, the overall goal of IBT is to increase functional, learning, and living skills, and to decrease the challenging behaviors. IBT treatment involves individualized programs and goals for each child based on their strengths and weaknesses, discrete child training in one-on-one structured programming, small group instructions and activity-based errorless learning, incidental and natural environment teaching, one-on-one support with registered behavior therapists and behavior therapists, ongoing supervisions with senior therapists and clinical supervisor. How intensive behavioral therapy impacts on children with ASD. IBT focuses on breaking down skills into small, manageable steps and using positive reinforcement to encourage desired behaviors. It is highly individualized and intensive, often involving around 20 to 40 hours of therapy per week. lead to significant improvements in cognitive, language, and adaptive skills for many children with ASD, creating predictable routines and clear expectations to reduce anxiety and improve focus. Engaging families in the therapy process is crucial for reinforcing skills learned during IBI sections. Monitoring and adjustment of therapy plans to ensure they meet the evolving needs of the child. Educational assistants can use these insights to better support students with ASD by implementing structured, individualized strategies and maintaining a supportive and consistent environment. Give strategies that helps your child develop skills that helps them, which you, the guardian of the child with autism, would learn these strategies in order to continue the process at home, so the child forms a routine with the learned behaviors much quicker. According to McMaster Children's Hospital, when intensive behavioral intervention is used effectively, it consists of a team that is comprised of you, the guardian of the child with autism, a senior therapist, an instructional therapist, a clinical coordinator, and a psychologist. The role of this team is to ensure that intensive behavioral therapy is applied both in the clinical and at-home setting. IBT and ABA Education Assistant Educational Support Person with the knowledge of applied behavioral analysis and intensive behavior intervention therapy. Educators can use the information to assess students with autism and students who might have other behavioral disorder. Applied behavior analysis therapy components assist to assess the behavior of students who show signs of autistic behaviors as it relates to intensive behavior therapy, which is connected to ABA. The educator can make recommendations by using the identifier principles. The educator can use one-on-one program to develop students' ability and encourage student autism to cope in school environment. For intensive behavior therapy, it is a short-term program which focuses directly on the child's direct area of challenge, which might not be autism but comprises of aspects of autism spectrum disorder, which affects the individual behavior. Some of the treatment to assist students can be applied under the supervision of therapists and can be implemented to encourage social skills in the classroom for autistic students and students with behavioral challenges. Academic strategies can be individualized education plans, tailored educational plans to meet the specific needs of each child, using visual aids to help children understand and follow instructions, creating predictable routines and clear expectations to reduce anxiety and improve focus. Engaging families in the therapy process is crucial for reinforcing skills learned during IBI sections. So in conclusion, both intensive behavior therapy and applied behavioral analysis therapy allow students to show improvement in the increase of their social abilities in completing tasks, communicating, and learning skills. It also helps to implement and maintain positive behavior like self-control and self-regulation, while teaching them to transfer learned behaviors to new environment. That is the end of our presentation. Thank you everyone for listening.